Infertility is a growing issue in the United States and around the world. According to MayoClinic.com, 10 to 15% of couples are infertile in the U.S. Because causes change drastically, many people do not know they are infertile. We will discuss the causes of Robert and Georgia and our recommendations for them. The male reproductive system is important for many reasons, but one of them is to reproduce. The bladder is where urine is collected until it is released through the urethra. The pubic bone is connected by the right and left hip bone. The pubic bone is just as important. It's what helps make up the pelvis. The pubic bone is covered in a layer of fat. The penis is a male organ that is used for urination and sexual intercourse, and it is located directly above the scrotum. It is made up of spongy tissue and blood vessels. The corpus cavernosum is part of a sponge-like region of the erectile tissue inside the penis. It is the part that holds most of the blood in the penis during a penile erection. The glans of the penis is a sensitive part at the end of the penis, otherwise called the head of the penis. On the penis is the foreskin, which covers the head or the glans of the penis. Traditionally, after a baby boy is born, the foreskin is removed because the foreskin covers the head of the penis, and that can cause blockage leading to an infection inside the penis, kidney stones, pain with urination, and bleeding through the penis. The process of removing the foreskin is called circumcision. The urethral opening is where urine or sperm leaves the body. The sigmoid colon or the pelvic colon is the part of the large intestine and is the closest to the rectum and anus, forming a loop averaging about 40 centimeters in length and lies within the pelvis. The rectum, about 8 inches long, and is practically a warehouse for poop. It hooks up to the sigmoid colon on the north side and your anal canal on the south side of your body. The seminal vesicle is a pair of small glands that are near the prostate. Their primary function is to produce fluid that makes up a significant amount of semen or sperm. The ejaculatory duct are paired structures, each formed when the vas deferens and the ejaculatory duct unite with the duct from the seminal vesicle. Working together, they pass through the prostate and open into the urethra during ejaculation. The prostate gland is a walnut-sized gland located between the penis and the bladder. The urethra runs through the center of the prostate gland, letting urine flow out of the body. The prostate's job is to secrete or produce fluid that nourishes and protects sperm. During the ejaculation, the prostate squeezes the fluid into the urethra and then leaves the body. The Cowper's gland is at fault for what most people call pre-ejaculation during sexual intercourse. This helps to lubricate the urethra from sperm to pass through, and it also helps flush out the residual urine or foreign matter. The anus is where your bowel movements happen, or in other terms, where you poop. The vas deferens is what holds the sperm with intention of ejaculation. There are 2 ducts to both the left and the right in order to move sperm into the urethra for an ejaculation. Right below that is the epididymis. The epididymis is the tube that holds the testicles in place, stretching from the back of each testicle where all the sperm is stored to the vas deferens. And the testicles are, of course, where the sperm is stored. And last but not least, the scrotum is a thick layer of skin and muscle containing the testicles. The scrotum usually becomes covered in hair at puberty. Each of these areas mentioned before are all influenced by hormones and the brain. The brain sends signals to your body when it's time to start puberty. To be specific, the part of your brain that does that is the pituitary gland, and that's when all the changes start happening around 12 to 14 years of age. In some situations, these parts are also affected by STDs. Estimated 2.8 million cases of chlamydia and 718,000 cases of gonorrhea occur annually in the United States. Sexually transmitted diseases are the most common infection for male infertility. More than 90% of male infertility is caused by low sperm count, poor sperm quality, or both. Having abnormal sperm can be from a number of different reasons, such as congenital birth defects, disease, chemical exposure, or lifestyle habits. But in most cases, sperm abnormalities are unknown. One of the more painful causes is called retrograde ejaculation. This is when the muscles of the bladder wall do not function during an orgasm, and the sperm is pushed backwards into the bladder instead of forward out of the urethra. Smoking cigarette, tobacco, or illegal drugs like marijuana can also affect your fertility because it will impair your sperm, making them incapable of getting the egg, or maybe making the sperm too weak to get into the egg to fertilize it, as well as drinking a lot of alcohol can lower your sperm count and make your sperm slow.
This is the brain. We all know this organ very well because you are your brain. This is the left cerebral hemisphere, and this is the right cerebral hemisphere. The temples, the cerebellum, the brainstem, and then the pituitary gland. The latter is what we are most interested in. This controls the hormones that are released. In women, we look for estrogen, which consists of 3 different hormones. There is estrone, which is the least abundant of the 3. It is almost always present during pregnancy and can be converted into extra estradiol, and is also the predominant estrogen in postmenopausal women. This is estriol, which is only produced in significant amounts during pregnancy. It is made by the placenta in the mother and by the liver and adrenal glands of the fetus. It is released when the fetus is distressed by preeclampsia, anemia, or impaired kidney function. Last, we have estradiol, which is a sex hormone. Also affects the other organs in the body as well as the health of the bones. It is 10 times as potent as estriol and about 80 times as potent as estrone. It is present in males as the active metabolic product of testosterone. This is the female reproductive system, which is divided into 11 different parts, each with separate jobs and tasks. The cervix, where blood, sperm, and other fluids can flow freely. This is also where the baby passes through during childbirth. These are the ovaries. They are nodulous to the testes in males. They are both gonads and endocrine glands. The fimbria is the fringe tissue around the ostium of the fallopian tube. It pulsates to help move eggs out of the ovaries. The infundibulum is the funnel-like tissue of the female reproductive organs oviduct nearest the ovary. The egg passes through here. The uterine tube, also known as oviducts or fallopian tubes, which is where the egg goes through to the uterus. The fundus is the section of the female reproductive system opposite the vagina and cervix. The uterus or womb is a major female hormone-responsive reproductive sex organ in females. The endometrium is the inner lining of the uterus. It functions as a lining. The myometrium is the middle layer of the uterine wall, consisting of smooth muscle cells. It also induces uterine contractions. The perimetrium is the same as the myometrium, just lower. The vagina is the fibromuscular tubular tract, which has 2 main functions, sexual intercourse and childbirth. There are many ways in which a female reproductive system can be altered that might cause infertility. Ovulation problems, fallopian tube damage or blockage, scarring or damage from STDs, endometriosis, pelvic inflammatory disease, or poor lifestyle, which includes drugs, alcohol, poor nutrition, low egg quality, or hormone imbalance, which is caused by a problem with the pituitary gland.
Fully aware that the use and or abuse of drugs and alcohol during pregnancy can have detrimental and far-reaching effects on the developing body, and that many of these substances are also known to harm male fertility as well. Future child, it would be in the best interest to quit drinking and smoking at least 2 months before trying to conceive. Many of the males who regularly drink larger than normal amounts of alcohol, 4 or more drinks in one evening, could end up having a serious and possible long-term issue with fertility. Alcohol is known to damage the liver, which is what makes white blood cells. White blood cells are essential for the reproduction, responsible for rebuilding and repairing damages done for both male and female. Male alcoholics can end up with higher levels of estrogen in their body, which can in turn suppress sperm. Smoking can also reduce a man's sperm count and significantly decrease the quality of a woman's eggs. In fact, smoking and the toxins which come with it can cause as much as 23% decrease in sperm density and 13% decrease in morality. Researchers believe that caffeine can affect sperm count, the quality of a woman's eggs. In fact, smoking and the toxins which come with it can cause as much as 23% decrease in sperm density and 13% decrease in mortality. Researchers believe that caffeine can affect sperm counts almost to the same degree as alcohol. If you do stop immediately, it takes up to 3 months for your body to reproduce healthy sperm. Smoking marijuana could cause a endocrine system to fail to complete its job. The endocrine system is a system of glands, each of which secrete, meaning produce and discharge different types of hormones directly into the bloodstream, some of which are transported along nerve tracts to regulate the body. Drugs, including cocaine, heroin, and ecstasy, have all shown to have dramatic effects on male and female fertility. Extensive use of these drugs can lead to permanent reproductive problems and could prevent you from becoming pregnant. Men who use cocaine, heroin, and ecstasy often suffer from reduced libido or sex drive, abnormal shaped sperm, poor sperm count. Women who use these drugs can also be affected and may suffer from ovulate dysfunction, menstrual irregularities, and reduced ovarian reserve. In addition, drugs heavily influence the human brain, especially the pituitary gland. The gland's ability to release hormones is affected by drugs and alcohol. This is an issue because the hormones released by the pituitary gland are responsible for ovulation in women and sperm production in men.
Our problemed couple, 21-year-old Georgia and 48-year-old Robert, have been together for a while now. They've also been trying to have a child, but lately they seem to be having some troubles. Georgia can't seem to get pregnant, causing this. The first thing we took a look at was their history to see if there are any possible reasons that this couple may be infertile. Georgia's past reveals that she has never had surgery, never even been injured. She is cancer-free. She is not a smoker, keeps a healthy diet at home, and has no past history of infertility. She has a normal menstrual cycle, but was once on the pill when she was 17 all the way up until she was 20 years old. She has only had one sexual partner prior to Robert, but has once had a sexually transmitted disease called chlamydia, and that was when she was at the age of 18. It was cured using antibiotics. Other than that one time, she is currently STD free. Robert has been a ranch hand and an oil field worker for 25 years. He has just recently retired at the age of 46, and he also has no history of family infertility. In high school, he was involved in the rodeo as a bull rider for 4 years. Throughout his life, he has had numerous sex partners and has absolutely no STDs currently. Now, after hearing some normalities and abnormalities of the couple, we are going to go to Dr. Wright, and he will fill us in on the tests that were ran and the results that were found during this problem.
Hi, my name is Dr. Wright. I am here today to talk about Georgia and Robert not being able to have kids of their own. In order for us to help this couple, we need to get to know them better. A couple things I found out about Robert is he used to be a high school bull rider, was into alcohol, and got into a motorcycle accident, causing injury to his groin. Usually all of these things can cause low sperm count, but they didn't affect Robert any. The one test we went through was the semen analysis. A semen analysis shows appearance, volume, cell count, motility, forward progress, viscosity, and sperm morphology. The semen analysis shows us the viscosity. Viscosity is a measure of the resistance of a fluid. For example, water is thin, having a lower viscosity, while honey is thick, having a higher viscosity. Sperm morphology is the size and shape of sperm and is one of the things checked in semen analysis for male infertility. Sperm morphology results are reported as a percentage of sperm that appear normal when semen is viewed under a microscope. In Robert's case, he had sperm morphology of 11%. Semen analysis measures the amount of semen a man produces and determines the number of cell count and quality. Forward progress of sperm. Other tests we used were STD test and blood test. The STD test we went through looked for gonorrhea, chlamydia, and syphilis. How the STD test work is visual examination of the genitals and urine test. Robert's results are negative for STDs. There are a few good things I found out about Robert. He has no family history of infertility, has no prescription drug use. Okay, now that we know a little bit about Robert, let's talk about Georgia. When I went through Georgia's files, I found many good things such as no surgeries, no smoking, no cancer, exercises 4 to 5 times per week, eats healthy, also has no family history of infertility. She was on birth control from age 17 to age 20, then got off the pill for 1 year while trying to get pregnant. Tests we did on Georgia were STD test, blood test, basal body temperature. Basal body temperature is the lowest temperature attained by the body during rest, usually during sleep. HSG is a X-ray of the uterus and fallopian tubes, which is used to determine if fluid can move freely through the tubes, and visualize the interior of the uterus to check for abnormal structure. The STD test we went through looked for gonorrhea, chlamydia, and syphilis. How the STD test work is visual examination of the genitals and a urine test. She was negative for gonorrhea and syphilis. For chlamydia, she tested positive at age 18 and was treated with antibiotics, which resolved the issue. However, her testing positive for chlamydia at age 18 resulted her to have scarring on the fallopian tubes. Through this information, you might think this couple's issue is Robert's sperm count, but the tests we went through say Robert's sperm count is normal. It is my theory that this couple is infertile because of Georgia's scarring from chlamydia when she was 18.
There are 2 main types of procedures that I would strongly recommend for couples that are infertile. The one that is most commonly recommended by doctors is IVF, also known as in vitro fertilization. In vitro fertilization is a process where doctors have the woman take medications to help her eggs in the ovary grow. Once they get the measurement of at least a 40 or 45, they will harvest the eggs. Then they bring them into a lab room and put them in an incubator. After this, they will take the sperm and clean it so it is prepared for fertilization. While they have the sperm being cleaned, a person in the lab will clean the eggs out of the cytoplasm walls that are protecting it. Then they will get the sperm and fertilize the eggs that are ready. Once they get the sperm ready to fertilize an egg, they will take a syringe tube with a needle point tip to inject the sperm into the egg. Then they put the fertilized eggs in an incubator for a couple of days. After that, they check the eggs to see if they had started to create cells, and you will see at least 2 cells for a start. Then they just let them grow for 3 days or until they have at least 8 cells in the blastocyst. Then they will talk to the mother and see how many fertilized eggs she wants put back in her. This is a question of how many children that the couple want to have. Once they get their decision, they will go up her vagina and into the uterus to lay the embryo so it can transform into a newborn, healthy child. If the egg does not succeed, then she has the choice of putting the other embryos or redo the whole process. There is one other way of conceiving a child if your uterus fails to protect the blastocysts and the fertilized eggs die. This procedure is called surrogate mother. This procedure is just like IVF, but you are not using the actual mother of the child to conceive the child. This process involves the father, the mother, and another person who is used as a carrier subject for the couple's baby. If you choose to not do this procedure, then you can see the other options that are laid out by the doctors for you. The one that I would strongly suggest if doing a new procedure
Get married and
is
have
called
children.
IUI.
What if there are complications that make this dream a reality? If infertility occurs in a man or a woman, then is there anything that can be done to still save these children? There are many treatments available for infertility, but let's talk specifically about one called intrauterine insemination, otherwise known as IUI. The process of IUI is fairly simple. It can be performed even if the woman is not an egg-producing medication. Firstly, sperm is taken and cleaned in a machine. This is to separate the semen and get more pure sperm. Then it involves inserting a catheter and from there inserting clean sperm directly into the uterus. From there, the sperm swims up the uterus and through the fallopian tubes to the ovaries, so that the eggs may be fertilized. The purpose of this is to increase the amount of sperm that reaches the fallopian tubes and increase the chances of fertilization. Furthermore, how long does it take for fertilization to occur? The fastest sperm can reach the fallopian tubes is in about 30 days, but conception can occur anywhere between 30 minutes and 5 days. Now you may be asking yourself, how successful is an IUI procedure? IUI procedures are more successful in women under 35, but the average success rate is 10 to 20% in one cycle. Now let's talk a little bit about tubal reanastomosis, otherwise known as tubal reversal. It is a procedure used to reverse tubal ligation, which is an operation to prevent pregnancy by burning the fallopian tubes to prevent passage of eggs. The surgeries involve making a small incision right above the pubic hairline. Then it focuses on the fallopian tubes, uterus, and ovaries, but most importantly reconnecting the two small ends of the fallopian tubes. After, the patient is given instructions and pain medications for about 2 weeks, and by that time most patients are back on their feet. This procedure is about 75 to 80% successful under optimal conditions and is a great solution to women who want to reestablish their fertility. In some instances, the fallopian tubes may become closed or obstructed, which you will hear about later. What can be done about this? In some cases, doctor will use a treatment called fimbrioplasty, which in basic terms is plastic surgery of the fimbriae and of the fallopian tubes. In such procedures, extreme caution must be used to release the multiple delicate fimbriae. This is vital in making the pregnancy possible. Fimbrioplasty can be described as a form of laparoscopy because it is very similar to procedures that involves inserting a very thin tube to see inside the body. During a fimbrioplasty, a doctor will use a small tool with a camera on it and another small instrument to help remove the obstructions. The doctor will enter through the vagina to the fallopian tubes. Then, the doctor will use their tools to remove any obstructions blocking the fallopian tubes. You may be asking, what is the success rate of this procedure? Fimbrioplasty has roughly around a 50% success rate.
But the main recommendation we decided to choose was IVF. And this was better because then it would actually allow them to take the egg out, because from the scarring it would block either entry or exit from either end.
So they had, if you took IVF, then they could take the egg out and then fertilize it and put it back in.
In case you didn't get from the video, the reason that Georgia and Robert can't conceive is because of the scarring that Georgia received from the chlamydia she had when she was 18. You guys have any questions?
It was stating that prior damage to his groin through a motorcycle accident and bull riding might have hampered his ability to produce. What would be going on there?
Well, we gave him a semen sample, which we had tested. Well, actually, we didn't test it, but we had already had all the information about it, and we had gotten back that he is normal amount of sperm, and it's that he doesn't have a low sperm count or nothing like that.
So the bull riding would lower his sperm count is the problem?
No. It actually did not lower it. It actually didn't affect his sperm stability at all, actually.
Okay.
But bull riding and accidents and trauma to the testicles can damage the endocrine gland's ability to produce healthy sperm, which is what was one of the main concerns. Anybody else?
I have another question.
Go for it.
How would you work around the infertility problem here? How would you solve this particular female's case?
As Quentin said, using IVF, using in vitro fertilization to remove the egg, fertilize it, and put it back.
So you can get past the scarification with the use of those utensils?
Yeah.
Yes. They go into the ovary, which is where the eggs are hanging out, and as they produce more, the 40 and 45 is basically the amount of eggs that she has produced in that one area, and so they'll take those out, and they'll clean them, find the good ones, and separate them from the bad, and then they'll fertilize the eggs that are ready to be fertilized.
Question on that. Even on in the gentleman here, his sperm count was okay. The sperm was normal according to tests and everything. Was there anything that could have possibly obstructed the sperm of from leaving his body into the woman at the time that could have held down the amount of sperm that was actually getting there and available to fertilize the egg?
Pituitary gland? Endocrine glands? Well, sort of. The endocrine glands in the testes and the tubes that lead up to the head of the penis, where the ejaculation goes into the woman, can be damaged. Like in bull riding, you can have a trauma to the penis, which can obstruct the tube in such a way that it'll only release so much before you run out or can't get any more out.
Was that found in this case? Was that found to be part of the cause? It was not.
No.
Yeah, so he had a normal sperm count. I would just a comment, I don't have a question. This could be easily a spin-off presentation on sports injuries, both for males and females, and it would be very appropriate. To my feeling is that kids or people who participate in bull riding, football, baseball, motocross, anything that subjects the body to or potentially physical injury, would be well advised to see a presentation about injuries and thinking about the future, fertility issues and that kind of thing. I think that would be very appropriate for them to do that. So this would be great. Jump in.
You guys mentioned that
your recommendation, or Quentin, that you said that your recommendation for this couple would be IVF. Is that pretty much the consensus throughout the group? Okay, and why is that?
Well, if we tried doing IUI, it probably wouldn't work because if the fallopian tubes were being blockaded so that the egg couldn't come out, then we would suspect that the sperm couldn't go through to meet the egg and fertilize it, come back down to the uterus and create a baby. And if we did surrogate mother of our first recommendation, which was IVF, and if that didn't proceed to actually succeed in its place, we would probably try a surrogate mother, which then would possibly up the chances of fertilization that will have the pregnancy.
There were other options available, but we chose IVF because it was kind of almost a sure shot for this couple. Yeah, we had two other options. We had taking extra vitamin supplements, namely vitamin A and E, to build up healthy skin around the scar, build up healthy tissue around the scars on the fallopian tubes and ovaries to eliminate those scars and let the eggs through. Or the fimbrioplasties to remove the scar tissue.
Did this couple actually, with the doctor's help, did they actually end up having the baby?
Actually, this
Or do you know?
is a real-time kind of a deal.
Oh,
As far as we know, if these people do exist, then we have no clue.
Well, that was my question. Do you have a couple that you are actually using as a case study, change their names?
Actually, we do have a couple that came in and they talked to us, and I don't remember either one of their names.
yeah,
Probably they'll want to know.
That doesn't matter.
Yeah.
For confidentiality.
Yeah.
They came in and presented their case. It was similar, but not exactly the same because they've already had the tests that when we came to our conclusion, she already had ultrasounds and all those things, and it wasn't the male's fault. It was the female's problem, but it wasn't exactly contributable to our original study.
So based off that, can you be a little bit more clear in some of the situations that were presented with the guest speakers that came in comparison to the actual case study that you guys were referring to in your presentation? What were some of the differences there? I know it's thinking back a little
They
ways.
actually had actually succeeded and actually had a kid.
Okay.
And then they were going to try again, but they couldn't do it. So
That's because the absence of a period through 5 years was
6 months.
She told us.
It was 6 months, and then it continued on for 5 years.
Exactly.
And there's also a vast age difference. Georgia and Robert Georgia was about half the age of Robert. And in our other live case study, there was closer age difference, like 1 or 2 years.
And another thing was our couple that came in and talked to us, she didn't have history of STDs, and Georgia did have a history of STDs. Any other questions?
You mentioned multiple causes for the female reproductive tract going on, different things like inflammation and scarification. Could you elaborate on what those would actually be doing inside there?
That was more my kind of a thing. There's actually 3 or 4 things I mentioned. Endometriosis, which is an inflammation of the endometrium, which causes it to swell with blood, which the body tries to get rid of during the period, which can cause lots of scarring because there's blood, it's got to be cut somewhere. And it scars it up and makes it harder for the endometrium and myometrium, the parametrium, to expand during the development of the kid, which will usually either cause in the body's abortion, an automatic abortion, or the inability to conceive. Another one was environmental factors, and one's contributed by the mother: drugs, alcohol, and just a poor lifestyle, which kind of goes into where she lives, like nutrition. If there's poor nutrition, there's no way that a baby can be conceived. Anybody else want to go, or anything else?
So pretty much saying that when she had gotten scars on her fallopian tubes, it caused scar tissue, to make down in the fallopian tubes, and the scar tissue had came out too much and had blocked a way for the sperm and the egg to, really connect. So there was no way that they could be, or she could get pregnant without an IVF, really.
Thank you.
Okay, I want to hear from Darian, because you're the only female in the group. Just a personal question, how did you feel about what you learned in this presentation as you studied it? Did you learn some things that maybe influenced how you manage yourself from here on out, or have you been doing fine, or?
I learned that you have to be really healthy, and it's not just like it's a whole bunch of other things that can happen to make a guy infertile or a girl infertile, not just like something's wrong with something inside of you. You could just be eating stuff that's not good for you, or smoking and stuff like that.
And Darian, what about the male reproductive system could also be influenced in the same way, in a similar way that happened to Georgia?
What?
Did you understand the question?
Nah, I'm guessing.
So if Robert, sorry, I keep getting the names mixed up. If Robert had the same issue with chlamydia, how would that affect him?
I don't know. It scars testicles.
Do you remember which specific part? Think of your diagram.
The epididymis.
Epididymis?
There you go. There you go. That one.
Gosh dang it.
There's a lot of scientific
Yeah.
terms.
You're good. You know it. You're fine.
Another question I have, is there any possibility of stress due to wanting to have a baby, anything like that? Because, the whole system starts with the brain. Is there anything that could have been an effect there with the couples that could have created the problem without it being a physical problem, more mental?
What I found out is that there was, that Robert had tensile stress, I think it was. And then there was another one, but I don't remember the name of it.
Actually, I have a thing to say. In one of the first days of this, when we got this problem, we were looking into possible causes of infertility. It was like the first thing we typed into Google. I found something about the pituitary gland releasing a stress hormone, which only happens when you're stressed, of course. And it's almost like a pesticide to the egg or sperm, which can happen on both sides of the party, which is a contributing factor. This couple could have nothing wrong with them except for the fact that they're really stressed to have kids.
Is that the stress you were talking about?
The tensile stress?
Tensile stress. Okay.
And the thing with our couple that came in and talked to us, because they really didn't have a determined diagnosis for why she can't get why she's infertile. But they're thinking that it has to do with the gland in the brain.
Pituitary gland.
Pituitary gland.
And another one of the things that we came up with trying to figure out for this one and the other couple, because we kind of got the cases mixed up for a